Hi, I'm Cedric Peterson from the Department of Communication, and this is an official government Hurricane Gonzalo assessment and cleanup update. GEBE continues to work to repair the national grid where current outages exist. The utility company is first addressing any potential dangers that may exist. There are several crews from GEBE that are working on addressing the situation with down poles. As it relates to water, there are some challenges with respect to water resumption in the areas of South Reward Hillside area, Mary's Fancy, and Belvedere. The resumption of water services is taking place in a cautious manner in order to avoid water leakage into the system. An alternative temporary water supply source is also being worked on for those areas mentioned above that do not have piped water. It has been decided that schools will remain closed until Monday, October 20th. This would allow adequate time for cleanup activities and repairs to take place. The Ministry of Education will meet at noon with school management and boards on Friday, October 17th to assess the overall progress being made in connection with the cleanup and repairs of schools in order to determine when schools can reopen. A further update will be provided based on the outcome of this meeting on Friday, as all schools, the Ministry of ROMI, and the Fire Department will work closely in the interest of a safe school environment for the students. In regard to port operations, the cargo port operations are up and running. In regard to the cruise facilities, preparations are well underway to make the cruise facilities ready, and additional information will be forthcoming with respect to this matter. In regard to the national cleanup, landfill is open. Persons are taking debris to the landfill need to be patient and wait their turn to enter the area. Cleanup continues under the Ministry of ROMI and private contractors. Large green waste bins have been placed at various locations along the main roads to collect hurricane-related debris. These will also be placed along secondary roads as well. Homeowners and businesses busy with cleanup do not dump bush or tree trimmings or other garbage and debris on top of GEBE water meters or electrical meters. This is to prevent damage to the aforementioned and an outage of service to consumers. Mudslides and rockfalls, residents must be mindful in hilly areas, should be mindful of the aforementioned. If a retaining wall has given way at your home, do not remove it at this point in time. Let the ground dry out. Removing it now would create further slippage of earth. I'm Cedric Peterson for the Department of Communication, and that has been an official government Hurricane Gonzalo assessment and cleanup update. For more details, be sure to log on to the government website, www.stmartengov.org.
Representative of the press, thank you. Welcome. Thank you for accepting the invitation from Minister in regards to a press conference. This opportunity we will use to inform our community in regards to our Ebola preparedness. And on the table we have with us representative of the ambulance department, representative of the airport, and of the Sint Maarten Medical Center, all persons, and of course, Honorable Minister and the head of the Collective Preventive Services. All persons will receive the opportunity to introduce themselves and identify their role after Minister's address in regards to the preparedness plan of Sint Maarten on Ebola. Yes, I would like to ask Minister to take the floor and introduce himself and his vision in regards to our Ebola preparedness plan. Minister.
Thank you very much, Ms. Henry. I want to welcome all the stakeholders here present today. Today is a date for us to just give an update and an overview of the Ebola virus and the very low risk that it poses to us at this moment. But however, we have been very proactive in addressing this. We already have the intervention management team that has been set up to deal with the Ebola virus disease. We have had a couple of press releases out there as well. The legislation regarding international health regulations that determines how we handle these situations has already been passed through the Council of Ministers, is at the Council of Advice, and then to be handled in Parliament. These are just some minor background and information, but more importantly, the question is how do we move forward? And Dr. Addison just came back from the Pan American Health Organization meeting in Washington, D.C., which I was supposed to attend, but due to The latest developments, I postponed it, but Dr. Addison is here to definitely give us the latest updates as far as what else we've been doing and what else needs to get done. Dr. Addison, I will now turn the floor over to you.
Thank you, Minister. Members at the head table, members of the press, good morning. Also, thank you for being here. As the Minister said today, we want to inform you about the status of our preparedness, and if there are any questions you also would want to know on what transpired in Washington, I will be happy to answer the questions. With regards to our Ebola preparedness, as we said in an earlier press briefing, the 31st, we started all the activities regarding our preparedness, and I can say that up to now we are still up to date. And I have to stress, same thing as Minister already mentioned, chances are very small for us to have a case here on Sint Maarten, but also what was stressed again and again in Washington also, when we had a special lunch meeting on Ebola preparedness, was also that although the chances are very small, preparedness has to be in place for everybody who is in the chain of response with regards to Ebola. Thank you.
Thank you. I will move now on to our stakeholder, the ambulance, for them to share in regards to how are they preparing for Ebola and the role in this preparation that Dr. Addison and Minister has referred to.
Good morning, ladies and gentlemen. Certainly the ambulance plays a very important role where the preparedness is concerned, and therefore we have engaged in putting things in place for the staff and also for the ambulance, because the ambulance as the first line, as I mentioned, we have to have things in place to be able to protect and also to be able to give the care that is necessary. Dr. Ellis was charged with the preparation of the plan, and I would like her to just give a brief little synopsis of some of the things that is part of our plan.
Hi, I'm Cedric Peterson from the Department of Communication, and this is an official government Hurricane Gonzalo assessment and cleanup update. GEBE continues to work to repair the national grid where current outages exist. The utility company is first addressing any potential dangers that may exist. There are several crews from GEBE that are working on addressing the situation with down poles. As it relates to water, there are some challenges with respect to water resumption in the areas of South Reward Hillside area, Mary's Fancy, and Belvedere. The resumption of water services is taking place in a cautious manner in order to avoid water leakage into the system. An alternative temporary water supply source is also being worked on for those areas mentioned above that do not have piped water. It has been decided that schools will remain closed until Monday, October 20th. This would allow adequate time for cleanup activities and repairs to take place. The Ministry of Education will meet at noon with school management and boards on Friday, October 17th to assess the overall progress being made in connection with the cleanup and repairs of schools in order to determine when schools can reopen. A further update will be provided based on the outcome of this meeting on Friday, as all schools, the Ministry of ROMI, and the Fire Department will work closely in the interest of a safe school environment for the students. In regard to port operations, the cargo port operations are up and running. In regard to the cruise facilities, preparations are well underway to make the cruise facilities ready, and additional information will be forthcoming with respect to this matter. In regard to the national cleanup, landfill is open. Persons are taking debris to the landfill need to be patient and wait their turn to enter the area. Cleanup continues under the Ministry of ROMI and private contractors. Large green waste bins have been placed at various locations along the main roads to collect hurricane-related debris. These will also be placed along secondary roads as well. Homeowners and businesses busy with cleanup do not dump bush or tree trimmings or other garbage and debris on top of GEBE water meters or electrical meters. This is to prevent damage to the aforementioned and an outage of service to consumers. Mudslides and rock falls, residents must be mindful in hilly areas, should be mindful of the aforementioned. If a retaining wall has given way at your home, do not remove it at this point in time. Let the ground dry out. Removing it now would create further slippage of earth. I'm Cedric Peterson for the Department of Communication, and that has been an official government Hurricane Gonzalo assessment and cleanup update. For more details, be sure to log on to the government website, www.stmartengov.org.
Good morning. Protocol already been established. The preparedness plan for the ambulance department consists of background and introduction and background information on Ebola, as well as the dispatcher's role when a call comes in, the questions that the dispatcher should ask the persons. And several of those questions is, have you traveled to or are you a resident of an Ebola-infected country? Have you been in contact with body fluids of an Ebola-infected person? Have you attended a funeral while at that country? And these are questions that are also asked, and we have downloaded these questions from CDC, as well as the IVM, which is a CDC in the Netherlands. There are also information on how the patient should be transported and personal equipment that the staff should wear, which consists of gowns, caps, face mask or the goggles, the shoe covering, and how they should also dispose of these protective gear. There's also a chapter on when they get to the hospital, but before getting to the hospital, they are to notify the Sint Maarten Medical Center, where they would get instructions where to take the patient, and cleaning of the ambulance. It's the normal household bleach is used, and there is a standard solution that is used in order to clean the ambulance. And when cleaning the ambulance, they are also supposed to wear the protective gear as well. And in disposing the gear, they are supposed to be disposed as hazardous material. Thank you.
Thank you. And then we move on to our stakeholder, Sint Maarten Medical Center, and they would share introduce themselves and also share the role in the preparedness plan and their contribution to the National Preparedness Plan of Sint Maarten.
Good morning, ladies and gentlemen. Representing Sint Maarten Medical Center is Ms. Glenda Seferin, our hygiene infection control practitioner. She will elaborate more on what our preparedness plan is about. I'm Tony Poniflet, Manager Patient Care and Education. I will give a little rundown on how we look at the big picture. It starts outside the Sint Maarten Medical Center, and it will probably end up in the Sint Maarten Medical Center. So we too have to be prepared. I think prevention is better than cure, and I commend government for taking this initiative and being on track and being on time with this. And I think it's important that all stakeholders take this seriously, because it looks far, but it could be very near to us. We are talking about, we have a contingency plan in place, because we are preparing for if an Ebola hits Sint Maarten, but it can hit Sint Maarten tomorrow. And as you know, Sint Maarten Medical Center at that moment is not prepared. But we have taken the necessary measures, such as we have isolation rooms, and if we have to get one patient, we have a room that we can put that patient. We also had to take into account that this patient may be an intensive care patient. So a patient that has to go on a ventilator, where suction has to be done. The room that we have prepared, we can host the intensive care patient right in there. Then comes the big question. Happen tomorrow that we get more than one patient, we have also taken the necessary steps that we will have to move our patients from one side of the the hospital over to the other side of the hospital. We may even have to be thinking about getting in collaboration with the French hospital if we have patients in Sint Maarten Medical Center that have to move. We have a room where that room will be designated for Ebola patients. Then in the long run, and that's what we're busy with right now, is to have equipped isolation rooms. And talking about equipped isolation room not within the hospital, so the patient will not have to be driven through the hospital, but you have a special entrance. Right now we are looking at it, we are doing a cost analysis of what this will bring up, what this will entail. And once we have that on the table, we hope that this week we'll have that round off, that we will take this to government and we go further from there. My colleague we have Ebola preparedness plan as well as an Ebola protocol that we put in place. And my colleague Glenda Seferin will inform you more on this.
As I was previously introduced, my name is Glenda Severin, and I'm the infection control practitioner at the Sint Maarten Medical Center. When we were invited by the Public Health Department to a meeting, all the stakeholders of Sint Maarten, to formulate a plan, I realized how important and how serious this plan was. So immediately I got on board and I advised our director to form an Ebola preparedness team. And the team would be in charge of preparing the hospital for, in case we do get an Ebola patient. At that time, it seemed so far away, it seemed it would be in West Africa. But our ports are open, we are a tourist island, and we know that once it started to get out of Africa, it would sooner or later reach Sint Maarten. For this, we do not want to even think about, but however, the reality is there. We prepared an Ebola plan, preparedness plan, and one of the purposes of the plan was to provide healthcare workers with the necessary information so that they can safely care for the patient with EVD, and we wanted to respond collectively and uniformly in a manner so that infection control measures could be implemented. I need to thank our director, Mr. Kees Klarenbeek, for being on board with me. Immediately, we went into ordering our gear, and I must say at this moment, our gear, most of our personal protective equipment has begun to arrive. We have gone into full-scale education. We have educated every department in our hospital as to what EVD is all about. And presently, I am training every staff who has immediate contact with the patient in how to put on and remove their protective personal equipment. We know that the chances of contracting EVD lies with a glitch, let us put it that way, in removal of the PPE. And we have seen where our colleagues in Spain and in America have became infected. We do not want that for our colleagues. And I personally, as an infection control practitioner, has taken it personally. And I am spending as much time and as much effort as I personally can to train our workers to ensure that they know how to remove. It's a technique, and the price is too high if you fail to remove your gear properly. The possibility arises where we may have two types of admissions, those coming from the family practitioner and those coming from the triage room. We have already brainstormed, we have already put in place measures whereby persons coming from the family nurse practitioner will not use our emergency room entrance, but will be brought in through our side door, our side entrance, and directly into our emergency room. Right now, we are planning, and our emergency room department are right now looking at their triage procedure and how they can protect the people who are in the emergency room, waiting area, and the staff. So far, we have put in place questions that will specifically pinpoint people, visitors to our church or people coming to our department, ER department, to see whether you have EVD or whether you have risk of having EVD. So these questions are in place, and we are working on a plan. If somebody answers yes to one of these questions, what are we going to do? So right now we are working on that and brainstorming and putting things in place. That person will be brought directly to our room 30, our isolation room. We have also formulated a protocol, which is a working procedure for our staff. We are using the guidelines from the World Health Organization to protect our staff. So in case a patient shows up today, I can say that we do have a working procedure which, if followed properly, should reduce the chances of any of our workers getting EVD. We also have a plan if one of our healthcare workers should contract EVD, probably by a needle stick accident. This person would become a high-risk contact, and we are planning that this nurse, we really do not want that to happen, will be placed immediately in isolation. We are also looking at our biohazardous waste. How are we going to get rid of our biohazardous waste? This protocol is right now under review, and this needs further planning right now as we speak by the SMMC and hopefully the government. We really need to look at what we are going to do with our biohazardous waste, because everything coming from the room of that EVD patient is biohazardous, and it must be disposed of properly. We are also looking at how we are going to get this patient a little bit more comfortable in our isolation room. We do know the effects of what isolation, the psychological effect of isolation on a patient, and we are looking at how are we going to get this patient who will not be allowed visitors, except for patients or parents of small children. How are we going to get this patient a little bit more comfortable? And we are looking at ways of improving our internet speed and some other means of communication with that patient, with his relatives. So we need to look at that. One of the things we are also looking at, which is very, very important, is our environmental cleaning. We also have a plan for that, and these, our environmental service staff, they are right now being trained. So we have left no stones unturned. We are trying, and I know that in reading the protocols, because I read every day, everything I get, updates from CDC, updates from the World Health Organization, because this is our only hospital. We need to protect St. Maarten, we need to protect our workers. So I am not leaving any stone unturned, and then we will be reaching out to our government, and I know that they are taking it seriously. That's why we are here, to further improve our plan for SMMC and St. Maarten.
Thank you very much.
Thank you, and we turn over to our other partner in this process, airport representative.
Thank you. My name is Khalifa Hickinson. I'm the Corporate Communications Specialist for SXM Airport, and we're happy to be here today to give information with the rest of the team. With regards to the airport, we are monitoring this situation. As the others mentioned, the risk to St. Maarten is extremely low, and we wish to also stress that. We are working closely with the company doctor, Dr. Hida Dequette, and he is advising us as we go further. He's also in close contact with Schiphol and Air France and KLM. As you know, we do not have any direct flights from West Africa, but we also need to remain vigilant and monitor the situation. We also have procedures in place as well. We have a plan, procedures for responding to infectious diseases that has been recirculated internally. Information has been sent out to staff, to our airlines. We want to make sure that people are aware of, you know, how you get Ebola, symptoms to look out for, and we're just making sure that everyone is informed. There will also be information sessions held with our staff by the Ministry of Health to give more information. We also have an isolation room. We do have protective gear available. The info sessions will also touch on how to correctly put on and take off the protective gear. So we are doing all possible to also be prepared for for this situation.
Thank you, Ms. Hickinson. I just want to mention a couple of things. Ms. Hickinson alluded to it, but because we don't have direct flights, understand that the first screening takes place in Europe or in the U.S. before anything comes down further, not just St. Maarten, other places in the Caribbean or Latin America. Those are the first screening. We are also in contact with the French side. Of course, as we progress, that also has to be stepped up and make sure that we're all on the same page. You know, we already have protocols in place as far as, for example, with the chikungunya. So using this platform for the Ebola virus would be the same way. We also have contact with the Pan American Health Organization, the World Health Organization, EDIVM from Holland, and CARPHA, as well as CDC. So these organizations, of course, are there to support us and then support any country that is busy dealing with this challenge. And last but not least, I want to thank everyone for being very proactive in addressing this issue. We have not winked an eye on this one from the very beginning. As soon as it came up, the incidents management team was put in place. Meetings were held with the GPs for about suspicious cases and what needs to be done. The department also has a pamphlet with information about the Ebola virus and how to prevent it as well, and what symptoms to look for. So I want to let the public know and rest assured that we are being way proactive, and we will continue to do so. And, you know, whether we think it's far, whether we think it's near, we still have to be prepared, and that's what we will continue to do. Any additional protective gear that needs to be ordered will be ordered. We already have a lot of protective gear that came in, so we're going to be using those should the need arise. But if we need any other special protective gear, we will also be ordering those as soon as possible. Ms. Henry?
Thank you. I thank everyone for their sharing. I don't know if they have questions, but I must take this opportunity to identify that players that are involved in this process not present are the Harbor, Immigration Department, St. Maarten Laboratory Services, as Minister mentioned, the GPs and the pharmaceuticals. So all members of ESF 6 in regards to preparing and discussing how St. Maarten can be ready to respond to this particular situation in the event of an imported suspected case. Thank you.
Thank you. Are there any questions? Since there are no questions, I want to again thank all the stakeholders for being here. Those who are not present but have been actively participating with our organization, I want to thank them as well. And let us just be very vigilant, but let's not panic. Let's just be vigilant, be prepared, and I know we also have some weather coming in, so I'm going to also ask you to be prepared for that as well. And have a wonderful day. Thank you.